Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is macrocytic anemia? Macrocytic anemia is a condition in which red blood cells are too large. The enlarged red blood cells are not fully developed and do not function the way they should. This causes diminished oxygen delivery to all cells of the body, resulting in fatigue and low energy. /r/n/r/n This condition can be caused by vitamin B12 deficiency, liver disease, alcohol, some types of cancer, and more. It is important for your medical team to identify the cause because macrocytic anemia can improve with the appropriate treatment. /r/n/r/n Sometimes long-term prevention is necessary with diet or supplements or with other lifestyle modifications, such as avoiding alcohol. /r/n/r/n Macrocytic anemia is characterized by macrocytosis, which is large red blood cells. Types of macrocytic anemia are categorized by the shape of the red blood cells. /r/n/r/n These types are megaloblastic macrocytic anemia and non-megaloblastic macrocytic anemia, which are /r/n/r/n Macrocytic anemia usually develops slowly over time. Red blood cells normally circulate for several months before the body naturally breaks them down and makes new ones. It takes a while for the enlarged red blood cells to cause symptoms, because there are usually healthy red blood cells in circulation as well. /r/n/r/n With macrocytic anemia, the large red blood cells circulate throughout the body, but they do not deliver an adequate amount of oxygen to the body's tissues. This causes nonspecific symptoms that can progressively worsen. /r/n/r/n Effects can include /r/n/r/n If you have a history or risk factors for macrocytic anemia, it's important that you are alert to these symptoms. They can be indicators that you are developing anemia, which is a diminished red blood cell number or function. /r/n/r/n There are several causes of macrocytic anemia. You can develop the condition due to just one of the causes, but you can also have more than one cause. /r/n/r/n Zoe Hansenrnrn Reasons that macrocytic anemia may develop include /r/n/r/n liver disease, alcohol use, hypothyroidism, underactive thyroid gland, myelodysplastic syndrome, bone marrow disease, leukemia, blood cancer, and some other types of cancer can also cause macrocytic anemia. /r/n/r/n Macrocytic anemia occurs when red blood cells are developing, but they do not progress to a mature and fully functioning state. /r/n/r/n Megaloblastic macrocytic anemia develops because vitamin B12 and folate are needed for the development of the genetic components of red blood cells. When these vitamins are lacking, the cellular portion of the red blood cell develops, but the genetic component does not adequately develop. This makes the cell large, but not properly functional. /r/n/r/n Macrocytic anemia doesn't usually cause physical signs that are detected with a clinical examination. You might have other signs that are associated with the underlying cause. /r/n/r/n For example, if you have severe liver disease, you could have jaundice, skin and whites of the eyes are yellowish, or you could have enlarged lymph nodes if you have cancer. /r/n/r/n If you have macrocytic anemia associated with alcohol use, you may have peripheral neuropathy, nerve damage usually in the hands and feet that affects sensation or movement, due to alcohol use and or signs of liver damage. However, these physical signs develop at late stages, and macrocytic anemia can develop before these changes. /r/n/r/n Macrocytic anemia can be diagnosed with a complete blood count, CBC, red blood cell indices, and a blood smear. /r/n/r/n Tests that can identify macrocytic anemia, /r/n/r/n Generally, A CBC is a routine blood test that is often part of a yearly physical, and it is also done to assess problems such as persistent fatigue, fevers, and unexplained weight loss. A blood smear or reticulocyte count may be done when there is a specific concern about the health or function of the red blood cells. /r/n/r/n medications that can cause macrocytic anemia do not always cause this side effect for everyone, so your doctors may monitor your CBC if you are taking a medication that puts you at risk. /r/n/r/n Another important component of the diagnosis is the determination of the underlying cause. Testing for the cause is guided by risk factors and other signs or symptoms. /r/n/r/n Other diagnostic tests you might have will be tailored to your situation. /r/n/r/n tests your healthcare provider may order for you include /r/n/r/n The treatment of macrocytic anemia depends on the cause. Treatment and prevention are closely linked together. /r/n/r/n treatments can include /r/n/r/n The treatment can help resolve the range of effects of the underlying condition, including macrocytic anemia. /r/n/r/n Generally, macrocytic anemia is expected to improve with treatment. It can take weeks or longer for symptoms to resolve and for the blood tests to normalize. It is important to maintain consistent treatment and to have your red blood cell measurements monitored at regular intervals as directed by your doctor. /r/n/r/n Macrocytic anemia can cause the same symptoms as most types of anemia, including low energy and generalized weakness. This condition can develop due to nutritional deficiencies, cancer, medication, alcohol, liver disease, and hypothyroidism. /r/n/r/n It can be diagnosed with blood tests. The treatment is focused on the management of the underlying condition. After treatment, anemia can resolve over the course of weeks or months, and it may require ongoing treatment. /r/n/r/n If you have symptoms of anemia, it's important that you get medical attention. The effects are vague and can develop due to many different reasons. Once you know the cause of your symptoms, you can get started on your treatment. /r/n/r/n You should feel an improvement in your symptoms, and you might notice a recurrence of symptoms if you ever develop macrocytic anemia again. Depending on the cause and severity of your anemia, you can remain on treatment for the long term, or you can resume treatment as needed. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.